Hello, everybody. Good afternoon, and welcome once again to our weekly media briefing, COVID-19 public health update as well, with Montgomery County Executive Mark Elridge. I'm Lorna Vigili, Hispanic Public Information Officer, and joining us today is Rich Madalino, who is the county's Chief Administrative Officer. Hello, as well as Dr. Earl Stoddard, who is Assistant Chief Administrative Officer, Sean O'Donnell, who is Program Administrator, Public Health Emergency Preparedness and Response for the Department of Health and Human Services, as well as Kimberly Townsend, who is a Senior Administrator for Communicable Disease and Epidemiology. Reporters, all of you should have permission to record, and if you do not, please utilize the chat to request it. With that, good afternoon to you, Mr. County Executive.
Good afternoon and greetings from Ocean City. I'm here at the Convention Center attending the annual Maryland Association of Counties Conference this week. Before I begin with the weekly updates, I just want to take a point of personal privilege just to express how honored and humbled I am to be certified as a Democratic nominee for County Executive. I expected a recount. It'll occur starting, I believe, on Friday and should conclude early next week, but I'm confident that not much is going to change. We had a recount 4 years ago. Mr. Blair picked up 2 votes then during that recount. I want to thank and appreciate everybody who supported my campaign and voted for me again. And I think it's really a testament to the good work and what we've been able to achieve. And I know that, our work on COVID meant a lot to residents in Montgomery County, and our ability to fund some things this year coming out of COVID is both a relief in terms of our ability to provide the support for schools and housing that we've wanted to support, but also to the residents who, can see that we were able to do this without raising taxes this year. So it's been a good year, and I just want to thank everybody. I also want to express my appreciation for the people who've worked tirelessly to count all the ballots. I do hope that we don't have to repeat the mistake of beginning to count mail ballots after Election Day, 2 days after Election Day to be exact, for the general election in November. It would only replicate the mess that happened this time with far more votes. And so I was very happy to see that the members of the Maryland State Board of Education voted to file an emergency petition in a circuit court to seek approval to canvass the mail-in ballots prior to Election Day. The petition will also require that any results from any pre-election canvassing be withheld until after the polls close on Election Day. And that makes perfect sense and is consistent with the way votes are, announced normally. So let's hope that they can do this. I don't want to put Montgomery County voters or any voters through what we've had to endure over the last couple of weeks, and it put an enormous load on our elections folks, the judges and the staff, because they suddenly had to count, tens of thousands of votes that were supposed to have been counted before the election, before Election Day. On other things, down at Mako, politics in the upcoming general election is surely going to be a major topic of discussions in Ocean City, but I'm more looking forward to meeting with colleagues from around the state and discussing our shared critical issues as well as potential partnerships. The big Democratic counties in the state have been able to work pretty well together, particularly on school issues in Annapolis, and I look forward to talking about what our common agenda is going to be and making sure that we're able to speak with as unified a voice as possible. The more unified these large counties are, the more unified we present to the legislature, the more likely we are to succeed. This is a time of great transition in our state. I know there's a lot of discussion about all the effects of that transition, and the upcoming general election results will determine a different path moving forward. Here in Mako this week, I look forward to talking about our vision and partnership with the University of Maryland for a School of Artificial Intelligence to be built in White Flint. It will be a critical component in accelerating our already robust gains in bio, life science, and quantum computing industries. And so I'm optimistic, very optimistic about what that holds for the future of Montgomery County. We're already seeing companies grow and expand and relocate to Montgomery County. DECA Biosciences started in an incubator and is breaking ground on 14,000 square feet of office space now. And another of our incubator companies, Arcelix, is expanding their Rockville operations by adding another 60,000 square feet of lab space. Verizon Therapeutics recently announced they're moving 192,000 square feet of East Coast manufacturing to the hub in Rockville. And Lentigen and Miltenyi Biotech is moving their US headquarters to the county from California, adding 130 new employees and expanding nearly 150,000 square feet. The success isn't limited just to our Life Sciences Center. This week, I attended the opening of the new AC Hotel by Marriott in downtown Bethesda. This hotel is at the intersection of Wisconsin Avenue and Montgomery Street, and it was formerly the home of the 2nd District headquarters of the Montgomery County Police Department. You'd never know that after you see what's in its place right now. It's a really beautiful building, a lot of work done to get this to happen. And it's just another sign of progress and a good replacement for the police headquarters. Montgomery County is proud to be the corporate headquarters and home to Marriott, and we're thankful for their continued investments in our county. Excuse me. And Montgomery County has nearly $2 billion tourism industry employing thousands of workers. And the AC Hotel is welcome news and a good sign for this economic center. I think everybody knows that hospitality just got hammered during the pandemic. And during that time, the county's hotel occupancy rate fell to as low as 9%. But it's rebounded. And yesterday they gave a note on this that the occupancy of hotels in Montgomery County has come back to 80% today. So 9 to 80% is a big change, and looking forward to more good news to come. This week, Montgomery County earned a AAA bond rating from all 3 rating agencies. It's an incredible accomplishment since only about 50 counties out of approximately 3,000 have earned the triple from Moody's, Standard & Poor's, and Fitch. And this year was a milestone as we earned a AAA from Moody's for the 50th consecutive year. And Standard & Poor's and Fitch have also been rating Montgomery County with AAA for the last 48 and 33 years, respectively. The distinction means Montgomery County is a top-rated issuer of municipal securities and that our government has secured the highest credit rating possible by a local government. We achieved this rating due to our strong fiscal management practices that held true even in the face of the economic struggles brought on by the pandemic, inflation, supply chain disruptions, and of course, the staffing issues that we're experiencing along with everybody else out there. Specifically, Moody's noted that we will, quote, continue to benefit from a dynamic and expanding economy, very affluent resident population, and a growing and highly educated workforce. And Standard & Poor's wrote that the, quote, county has leveraged its very strong economic underpinnings to support its sound financial position and has historically maintained a strong or very strong budgetary flexibility. And while Fitch reported Montgomery County, quote, demonstrated the capacity to absorb revenue losses during periods of economic downturn, they lauded our office for sound fiscal decisions to restore and enhance the county's fiscal cushion and operations during the recovery periods. None of these reviews from these credit agencies sounds like we're mismanaging our county's finances. In fact, the bottom line is when I came into office, we inherited a $90 million deficit, and we're now running surpluses and revenues and we're able to do this without even using the federal COVID money this year. Our AAA bond rating allows the county to sell long-term bonds for capital improvement projects at the most favorable rates, allowing us to maximize savings over the life of the bonds. Basically, it's the equivalent of the county having a perfect credit score, meaning that we can sell bonds and raise funds at lower interest rates, and that saves you, the taxpayers, money. That means that projects like a new library in Clarksburg or a new wellness center at John F. Kennedy High School in Wheaton can be financed at lower interest rates. Improvements in Montgomery College, such as financing the new East County campus, as well as many of our infrastructure projects, can move forward and they will cost us less. We're confident that we're going to have a successful upcoming bond sale due to these 3 rating agency reports. I want to thank the Department of Finance, Management, and Budget, all of the financial stewards throughout the county government on earning this achievement for 5 decades in a row in county. And today I asked CAO Rich Madalino to join our media briefing to talk more about what the AAA means for our government and our taxpayers.
There you are, Rich.
Okay, we're just waiting for the switch off of microphones. One of the joys of joining you from Ocean City and the Maryland Association of Counties Conference. I'm here with not only the county executive, but many council members and leaders across county government in Montgomery County to share our good work, trade best practices with our colleagues from around the state. And of course, the county executive failed to mention that he is a board member of the Maryland Association of Counties, recognizing the large role that traditionally Montgomery County plays on a statewide basis as the most populous community. So I wanted to further some of the comments that the county executive made about our AAA bond rating by reminding you 50 years of having a AAA bond rating for Moody's. That puts me in first grade in the Montgomery County public school system, Richard Nixon in the White House, the stock market at 1,000, and Elvis still alive. So it's been that long since we've had a AAA bond rating, or we've had a AAA bond rating during all this time. And it is a testament to the strength of our county, our management system, and our the strength of our local economy to have a AAA bond rating. Because, you know, when you look around the country with states and counties that have AAA bond ratings, many of them have it because they don't issue much debt. You can look at a state like South Carolina that's AAA bond rated that doesn't issue much debt. So whenever they borrow, you know, it's like if you only have one credit card, your credit rating is pretty good. But considering we are aggressive at investing in our economy, in our community, in our young people, building schools, libraries, roads, and the fact that the way Maryland is uniquely set up, that as a county government, we are responsible for many services, a lot of our transportation network. We are out there in the market issuing hundreds of millions of dollars of debt every year to build and support our community and our local economy. And still the rating agencies say this is a great investment. In fact, it is the best investment you can have in the country, which is why we will have, again, amongst the lowest interest rates that you can get this moment, which does do what the county executive suggests. It saves money for the taxpayers. And considering we're borrowing for the next 20 years, we issue 20-year bonds, it's not just the taxpayers of today, but it is our children and grandchildren, the people who will call Montgomery County home over the next 2 decades, who will benefit from the prudent decisions of this administration, this council, to make sure we continue to be in the best position. You know, when you look at some of the numbers and some of the language that the rating agencies put out, Standard & Poor's talking about the county's very strong property wealth and income levels, robust local job market, and access to the greater capital region. That's why we continue to be a AAA bond rated community. And just 2 weeks ago, when the county executive and I joined the council president and vice president and leaders from around county government to meet individually with each one of the rating agencies to do our presentation about the strength of the county, the steps that we've taken, where we are, where we're going, the rating agencies were in fact impressed, very impressed. Comments that were made during the conversation were exceedingly positive in the conversations we had. And you know, the point that we made, in fact, with the type of investments that are coming into Montgomery County right now with the life sciences, recognizing that report after report shows that the Washington area has the 4th largest concentration of life sciences companies in the country, and the 2nd highest concentration of life science professionals in the country. And we all know that industry in the Washington-Baltimore area is anchored within Montgomery County. The 270 corridor, NIH, FDA, the 29 corridor, where we have all of these globally important institutions of the life sciences headquartered. We are the epicenter within the Washington region of this incredible effort. And therefore we are the epicenter globally of the life sciences. And when they are looking to expand, and the point we made, and in fact, the county executive and I sat through a recent meeting with a group of developers in the life sciences space who characterized this as a once in a generational opportunity for economic development, to seize this opportunity to build the lab space that companies are in such desperate need of. Lab space that when the county executive walked into office 4 years ago, we couldn't get private sector entities interested in building or locating in Montgomery County. Now they're knocking down the doors in order to get the space available in Montgomery County. 3.5 million square feet currently under development, under construction, or in the planning process of lab space. What is so critically important and different at this moment of time about lab space is it actually requires workers to be in the lab to do the work. It is a work that does not lend itself to virtual working arrangements. So while buildings around the region and around the country that were built as office spaces are only available or only filled 1, 2, 3 days a week, lab space will have people in there working every day, day in and day out on their experiments. So the beauty of it is, in the traditional way that you think of the multiplier effect of this effort, you have people who will be coming there for breakfast, for lunch, for shopping after work, for getting together for dinner. So when you see these new buildings going up along the central part of 355 in the North Bethesda area, in the Shady Grove area, these are places where people will be coming to work on a daily basis. And that is so important for, again, what I was saying, the multiplier effect as they support other businesses, grocery stores, restaurants, dry cleaners, that also help spur the local economy, and which has been a hallmark of our community for decades. So it's an exciting time, and we are reorienting county government in order to make sure we are there to quickly move to seize this moment. Meeting with, and the county executive has been meeting with the local utilities to try to make sure we are all together. When a company wants to move forward with a project, we can help deliver that project through the planning and permitting process as quickly as possible, because we know this is a unique opportunity that we may not see for decades to come. When you look at the footprint and of this development, and we said this to the rating agencies, with 3.5 million square feet just currently under construction, development, or in the planning process, that's roughly equal to the footprint of Amazon going into Arlington County. So we competed, we tried to get H2Q, Amazon's second headquarters in the county. Arlington County beat us out on that, although we're still getting plenty of people in Montgomery County working at Amazon and their H2Q. That actually the investment that's happening in the life sciences in Montgomery County just over the last several months equals Amazon's footprint in Arlington. So it is an enormous impact, and you see that by crane after crane after crane as you drive around the county, especially in the 355 corridor. And you partner that with the investment of the hospitality industry. The county executive mentioned Marriott's new international headquarters. Choice is moving their international headquarters down the pike to Pike and Rose. We have the greatest concentration of hospitality headquarters in the country. So it's another area of private sector expertise and leadership that we are looking to partner with and make sure they have the tools to grow over the next few years and decades. So it's an exciting time, and you can see that with the enthusiasm with which the rating agencies put out their press releases in support of, again, not just the robust local economy, the steps that we've taken, but the outstanding, I'll quote S&P again, sophisticated management team of the county government. that works with a comprehensive set of formalized financial policies and practices, in addition to a very strong institutional framework. So again, Wall Street's watchdogs are very careful to monitor how local governments and state governments are behaving. And year after year, administration after administration, we are singled out as amongst the best in the country. And our taxpayers, our residents, and the businesses that call Montgomery County home all benefit from that. And it's exciting to see that once again be recognized by the rating agency. So thank you for letting me come on, and we're happy to answer questions for you about the AAA bond rating at the appropriate time during the press conference.
Thank you, Ms. Madaleno. Members of the media, we're going to open it up right now for Q&As regarding the AAA bond rating for the CAO and or the county executive. Reporters, any questions? Once? Twice? Okay, I guess we can move forward with a public health update. Mr. County Executive.
Okay. Have I switched my mic appropriately?
Yes, you have.
Good. So back to COVID-19. And thank you, Rich, for joining me in this update. COVID-19, our community level status has been floating on the line between medium and high for the last 4 weeks. We've now dropped below 200 cases per 100,000 people, and our hospitalization number and rates have also dipped. And it gives us a community level status of low. There is not a lot of difference between these different states of being, but we're happy to be in low for now, and hopefully this will maintain itself. I know a lot of people are expecting a spike as kids come back to school and people return from vacations, but better have that spike coming off a lower point than having the spike come off a higher point. The numbers are encouraging, but I will say that, we continue to lag in people getting their boosters, and that remains a problem. Our data shows that vaccination and vaccination plus getting the boosters makes a real difference in outcomes for people who get COVID. And that's a big concern, knowing that Omicron is capable of infecting people who've been both vaccinated and boosted, with much greater frequency than earlier variants. It may not provide absolute protection against getting sick from COVID. It has a very positive impact on reducing the severity of COVID and the death rate from COVID. As you can see from the chart, if you're unvaccinated, you are 3 to 4 times more likely to test positive for COVID and 4 times more likely to be hospitalized than people who are vaccinated and boosted. And for adults who haven't gotten vaccinated yet, we now have access to the Novavax vaccine that's being produced in the traditional way. And we know that some people had ethical, religious concerns about how the mRNA vaccines were produced, and we're avoiding the vaccines for that reason. With the Novavax vaccine, you don't have to worry about those issues. And if that's the thing that's been a barrier to getting vaccinated, please come in and get yourself and your family vaccinated now. We learned last week that CDC is no longer requiring students exposed to someone with COVID-19 to be quarantined if they're not showing any symptoms. Additionally, our school system is currently recommending a mask optional approach as we start the school year. But if cases arise in schools or outbreaks are identified in particular schools, MCPS has the option of implementing their own face mask recommendations, either per class or campus-wide. Our Health and Human Services Department has been meeting with school leaders, and they're encouraging every family to take advantage of the county's vaccination opportunities, particularly from now until the start of the school year, to make sure all your kids are up to date on their COVID vaccinations and boosters. It not only helps protect them from getting severely sick, but it also helps in our community by limiting the potential for community spread of COVID among teachers, students, and school staff. On a note on Monkey Pox, today. It's something that we've been on our radar since May. Residents who believe they've been exposed to monkeypox because they're showing red, itchy sores and pimple-like bumps should contact their healthcare provider or community providers such as an urgent care center. Those without healthcare provider can also call the Disease Control Program at 240-777-1755. We remain limited in our response due to a nationwide shortage of vaccines, which can be used pre and post exposure. We've been in contact with patients that the state tells us have tested positive and their close contacts through contact tracing. We're currently building a pre-registration list that's now got close to 2,500 names attached to it. When more vaccines are available, we can contact people and get them quickly scheduled. This is a 2-dose regimen, and to pre-register for this vaccination, please visit montgomerycounty.md.gov/MPX. This upcoming Monday, August 22nd, the County Health Department leaders will be hosting the first in a series of virtual town halls focusing on monkeypox, also known as MPX. It will cover prevention, treatment, clearing up misinformation that's been linked to the community health threat. Attendees will also have the chance to ask questions and share concerns about MPX. And that event can be seen live on Montgomery County's Facebook page on County Cable Montgomery. And if you miss it, we'll have a replay of the entire event available soon thereafter. We hope you'll join us for this very important town hall. We are in the back to school phase. And finally, before I turn this over to our health experts, yesterday I met with Dr. McKnight, our superintendent, and I was really impressed by their preparation efforts. I offered my continued support, and I'm confident that we'll have a safe and productive school year. The really good news is that we're rapidly closing the staffing gap that had many people concerned and was a topic of much discussion over the last couple of weeks. They've been able to do some serious hiring and recruitment, and I'm encouraged about where they are, and I'm feeling very positive about where they will be when we finally open for school. It's important for the successful opening of our schools, and I appreciate the all-out effort they made at recruitment for these essential positions. The learning loss in the pandemic is still impacting our students, and I was pleased that our 23 budget was able to provide record funding for MCPS for their staffing, resources, and technology that's needed to help all of our students thrive. I want to add that, part of what we did this year was support moving the school closer to meeting the blueprint guidelines for school salaries. That's a big issue in recruitment, and it's important that we be competitive. And they believe that the improvements in teacher pay have helped them in the recruitment effort they're making now. I encourage all MCPS parents and students to please participate in the upcoming back to school fair at Westfield Wheaton on Saturday, the 27th, August 27th, from 10 a.m. to 1 p.m. It's a free event, and it's an opportunity for families to learn about the school system as well as county programs and services. And we'll also be providing a free COVID-19 vaccination clinic, COVID rapid tests, and critical information for the health and safety of the students and their families. So if you're a parent and want to get more information about what's available and the programs that are in the schools, please come to this event this Saturday, Saturday the 27th. And thank you all, and I'll turn this over to Sean for his update.
Thank you, Mr. County Executive. Okay, just a very quick review of where we are with the variants. As we have been for the last several weeks, the vast majority, almost 99% of the new COVID cases in our region are projected to be either BA4 or BA5 family of variants. So again, this is where we are. When we look at some of our declining numbers, it gives us some indication that the transmissions may be going down right now. Again, we do know when people return from vacation and when they go back into school settings that there's more contact between people, and so we'll continue to emphasize testing as an important way to determine the safety of going back into these settings. In general, the CDC has updated some of their guidance and is de-emphasizing screening testing for the general population if you're not symptomatic or you haven't been exposed. But there are some times in certain settings when that does make some sense. And we are in planning communications with our partners at MCPS about different ways to get test kits out to the community so that families can test before they go back to school. We also have seen the numbers for the hospitals dip down. We actually asked our data team to expand one more decimal place, and they did that a few minutes ago. That does actually show that we've dipped below that 10%. But again, these are likely to fluctuate a little bit as we go forward. And it's why we emphasize that these are helpful pieces of information. The CDC's guidance works, largely across the entire nation, but needs to be interpreted by local communities as to how it impacts those communities. Looking specifically within our hospitals, we have seen decreases in the number of individuals who are with a COVID diagnosis in acute care beds, as well as in the ICU. We're hoping that those trends continue to come down. Obviously, that those more severe illnesses are concerning to us. And again, we are tracking mortality. We're hoping that this month we'll have lower numbers. And again, that even as some of the guidance is relaxed, that our populations remember that when they are positive with COVID or while they're waiting for results from their test, even if they've left isolation, please try to avoid individuals who are at higher risk for severe illness, especially while you're still in that contagious window, those first 10 days, or until you get a negative rapid antigen test. Looking at our pediatric vaccination efforts, we've noted that much like the other age groups, each time we go down to a lower age group, it's a little bit of a slower rollout. I think some of the urgency is a little bit different than when we started. We're still strongly encouraging families to bring in their under 5s to get them vaccinated. It's a safe vaccine, as in probably few vaccines that have been tested over a larger group of people than this vaccine has. So we encourage people to come out and get vaccinated. There's a number of back to school events, and we continue to be at a number of our Montgomery County public schools on the weekends giving this vaccine. And just a reminder, we now are at those weekend clinics offering not only the under 5 vaccine, but the 5 to 11 and the 12 and up Pfizer, so that the whole family can get their boosters while they do that one visit. This does represent approximately 17% of the Montgomery County population at that age group, and with a single dose, and almost 5% now that are fully vaccinated. Of course, these are numbers from last Friday. The state will update this again on Friday. Looking at our testing sites, we're still seeing higher positivity rates at our sites. I think across the entire county, the positivity rate is closer to 13%. But again, we're seeing lots of individuals at our sites who are being tested because of symptoms, and that's the reason for higher rates. And now I'd like to turn it over to my colleague, Ms. Townsend, to talk about our Monkey Pox cases. The data that I'm sharing on the screen right here is from yesterday's totals. I know that this has already been updated for today, so urge our friends in the media to look at that link, at the CDC link for today's data. These numbers are changing fairly quickly from day to day.
Thank you. Good afternoon. As you can see, looking at this graphic, there are a total of 11,890 cases of MPX nationwide, and in our state of Maryland, 306 cases. So we do continue to see an increase in cases. Just a review of the criteria and a reminder that we still have received a limited amount of MPX vaccine, and we hope to expand our criteria in the coming weeks as we receive more vaccine. Our criteria has not changed. We are providing vaccination to those that are known contacts who are identified by public health via case investigation, contact tracing, and risk exposure assessment. We're also providing vaccination to presumed contacts that meet the criteria of having exposure within the past 14 days with MPX. Our pre-registration survey has been active on our website for a few weeks now. As mentioned earlier, we have received over 2,000 responses at the close of last week. And we continue to work on expansion of our capacity to provide vaccination. We have used all allotted vaccine that we received for phase 1. And at this point, nearly all vaccine for phase 2 has been administered and allocated for second doses. So this week we did request additional vaccine, and we are hoping to hear about how much we'll receive within the next day or so. We continue to be in ongoing planning and discussions with the Maryland Department of Health and monitoring federal updates on administration options, which may be able to expand the vaccination covering and using available vaccine. In other updates, again, we have planned a town hall discussion for Monday, August 22nd, and we are continuing to work on planning additional town hall discussions.
Okay, I think that is the updates we have. I wanted to add one other thing, that on our county's MPX page, there is not only we continue to update the information as we learn more about MPX and more shared from the CDC and our state partners, but one of the links that you can open up there asks, how can I get a monkeypox vaccination? And as Ms. Townsend mentioned, we have the pre-registration survey. Again, this is currently aimed to identify individuals who have been at risk for an exposure already. But we want to mention that this survey is also available in all 7 of the county supported languages. So we're working with our partners to help get that out to more people so that, again, we know how to contact them when we have more vaccine. And then as the criteria are expanded, we'll also expand that on the survey and notify the public as well that we've expanded the criteria. Dr. Stoddard, do you have any additional comments you would like to add?
Yeah, just a couple. So if you've been paying attention to the news, you will know that the United Kingdom became the first country to approve the bivalent COVID-19 booster. So that's a original strain mixed with, it's actually BA1 that they've approved in the United Kingdom. We expect that ultimately that will be available in the United States in either September or October, because the federal government, I believe wisely, asked the manufacturers to go back and actually use BA5 as the Omicron variant that is available in the bivalent vaccine that they'll be using in the United States. The companies agreed to do that, and they're going back, and the United States has already purchased a large quantity that will be distributed as soon as it's available from the manufacturers, hopefully again in September or October. I've seen some questions online about whether it's prudent to get a booster from the original strain now or wait for a booster when it becomes available with the bivalent. I would expect that decision is largely based on an individualized risk assessment that you should conduct with your medical provider based on your underlying health conditions, your your ability to access a booster right now in terms of eligibility, what your exposure characteristics look like, and some other questions. So I encourage you to consult with your healthcare physician if you're uncertain as to whether you should get the current booster based on your profile, or wait until the bivalent booster is likely available over the next 6 to 8 weeks. So that's all I wanted to cover. We're enthusiastic and preparing for that next booster round, but obviously we've started to get some questions about whether it's best to wait or to go ahead with the current booster. So I'll stop there and turn it back over to Lorna.
Thank you, gentlemen, and Ms. Townsend. I think we have the first set of questions coming from Kate Ryan, WTOP. Good afternoon, Kate. Kate, unmute.
Thank you very much. I did want to ask about the protocols for schools in terms of working alongside the new medical officer there. How do you see that working? And the other question I have is in terms of the percentage of children going into school right now, do we have a good figure on how many have been fully vaccinated against COVID?
Well, I can attempt to pull that data. I'm sure it's on our dashboard by ages, or I'm reasonably sure, but I'll go and look at that, Kate, and happy to, if it's not, prepare that for you all. But I don't think we'll have it differentiated between public and private school. It's just by age within our county.
Okay.
The question about the chief medical officer within MCPS, I can tell you that Dr. Bridgers, our health officer, is in conversation with her almost every day, especially as they're working. There's been some updated guidance from the state recently, and we saw that late last week, the CDC also updated their guidance related to K-12 and early childhood education centers, or childcare, as we often refer to them. And so we're working to ensure that as we implement this updated guidance, we're consistent, and we're tracking what the CDC is recommending versus what the state's recommending. Very, very similar guidance between the two of them. So we are working through that. And then just remind you, of course, that that is, of course, guidance, and MCPS can elect to do, how they want to implement that guidance and what protective measures they'd like to do. We are recommending a layered protective approach. I know Dr. Bridgers has mentioned that often on this call. So again, the private schools, the public schools, and the childcare community, they all will share this updated guidance. I know they can see the CDC guidance on the website, and the Maryland Department of Health and the Maryland State Department of Education have already distributed their guidance to all of these partners already. So I'm sure they've already been looking at that and determining how to implement.
Thank you. And just quickly on the drop from high to medium now to low, is there any, and I'm assuming it's going to be a layered situation, but how did we get there? How do we get to that low category?
Well, as you saw from the chart, one of the key, there's three key stats that the CDC uses. And again, I'll be honest, the CDC needs to use nationwide certain metrics that are available to them in every community. A lot of communities have different information surveillance tools that they can use. This just happened to be what the CDC has available for every community. When our transmission numbers from PCR tests went below 200 per 100,000, that was the first step that moved us into medium, or the possibility of low. When the hospital numbers came below 10% of their staffed inpatient beds having a COVID case, and 10 or fewer new patients per 100,000 average per day. That was all three of those things aligned, and now we're in the low. But you can see from what we shared, we are right on the edge there. We could easily go back into medium tomorrow. Now, these are 7-day averages, so it's not as prone to those little fluctuations. Just remind you all that we report this as the data comes in, which in most cases is every day. The CDC is at the top of their community page, which is where most people look. They update that once per week. If you go further down their page, you can see more of their daily numbers, but just reminding people, our numbers are being updated in most cases every day.
Hey, I
Thank
think
you very
might
much.
were you asking what why, like what's the reason for us going in terms of not just what the criteria are, but is that where you were asking in part there?
Yeah, getting into that because I think people go, great, how did we do it?
Yeah, so I would say first off, respiratory illnesses are generally more seasonal in nature, and so you would expect transmission to be generally lower over the warmer periods of the year, given people are more outdoors and outdoor transmission is much more rare. I think what we saw when we went to high and then medium was BA.5 took over. It was a new strain. There was very little existing or lower existing immunity, certainly within the population. It takes over. It spreads through its available host targets within the human population. And then those who are going to get infected have already gotten infected. Now you start to see it go back down to that periodicity that you expect with a seasonal illness. And so I think that's what's driving our coming down, is that we've converted it over to BA.5 more fully. The targets that it had within the population who are susceptible to infection with BA.5 have either largely gotten infected or been exposed and fallen off. And now we're moving into that more expected low to medium transmission that comes associated with the summertime. I would fully anticipate that as we move back indoors in the fall, we will see an additional surge again, whether it's BA.5 or another variant that emerges. And there's a subvariant of BA.2 that's circulating in some places. And so I think it's the abnormal thing was for us to see high transmission over the summer, and that was largely because BA.5 took over.
Thank you.
Thank you, Kate. Up next, Steve Bonell, Bethesda Beat. Good afternoon, Steve.
Afternoon. Just some monkeypox questions. So one of the slides said that all the doses for the first round of doses for people who have been identified have been used, but there were some remaining for the second dose. I just wanted to get some clarification on that, I guess, to start off, because it's a 2-dose vaccine, so I'm just unclear on that.
We've reserved the second doses for everyone we've given a first dose to ensure that we can bring them back at the currently recommended frame, which is 4 weeks later. We also have set aside a small amount for those individuals who are being provided to us from the state as confirmed contact. And so we've been seeing a certain number of those individuals week to week, and they get referred to our disease control team. So we want to, this is really our highest priority. These people have been confirmed to be in close contact with a confirmed case. And so we've set a little bit aside to ensure that we have enough to get through the month of August and hopefully until the next vaccine supply. Again, we've made a request for more vaccines, so that could be sooner rather than later, but we have set a small amount aside for that. Virtually all of the first doses we've been allotted has now been allocated.
And so the 300 doses that I think you mentioned last week, is that 150 people, or has that been updated? If it's the amount of people you can serve with the vaccine you have, I guess.
So that actually, Steve, that is a great question. We've been in conversation with the state because we've been watching the FDA approval and the CDC approval for an alternative administration of the vaccine, which would allow us to use existing doses for more individuals with equal efficacy of using it. And so we're, again, working with the state on when that will be approved within the state to do so, and the other logistics of beginning doing that. And potentially that could increase with our remaining supply, even our remaining second doses could increase the number of people we can vaccinate.
I'm sorry, what you just said, smaller doses? I get, what do you just to stretch the vaccine out further? Is that what you're saying, or is it more complicated?
Yes. And I'd ask if Ms. Townsend can explain further. But there is an intradermal administration of the vaccine that the FDA and the CDC have approved and recommended that allows you to use a smaller amount of vaccine. And when given intradermally in the skin versus subcutaneously below the skin, it is more effective at providing that immune response. At a smaller dosage, it's more effective. Kimberly, I'm hoping I'm in the ballpark here, and you can explain this a little bit better.
No, I think Mr. O'Donnell explained it very, very well. And so, as he said, we're in planning with Maryland Department of Health so that we can expand or get the maximum use out of the doses that we receive.
And I'll just add, just so we're clear about this, this is something that the federal government is actually moving towards a recommendation on as the states and localities prepare for it. So this change will expand the available doses by lessening the inoculatory dose.
Got it. That's good to know. So have you administered vaccine to about 150 people? Again, I'm just doing the math roughly. I don't know if you have a rough number of how many people have actually gotten the vaccine locally.
Kimberly, do we have the, I know it's more of an estimate right now than a hard number, just because it's changing every day as we administer it.
Right. I think our estimate last time was closer to 400, and that some of that includes second doses, but mostly first doses.
Okay. You obviously are asking the state for more vaccine. Have you asked for a specific amount, I guess?
Yes, we've requested 2,000 additional doses. I'll be honest, I don't know if I don't have the total that the state has available or the timetable at which they might get more vaccine. So it would depend on both of those. But we believe that we'd be able to vaccinate easily that many people based on the criteria. And of course, we hope to be able to expand the criteria as well. But just within the existing criteria, that would be enough for first and second doses for a significant additional number of people.
So for 1,000 people, but given what you just said, it could be more. Am I following you correctly?
That is correct. And that may be if that amount is not available, and of course, we're one of many counties in the state who are looking for more vaccine. If that level of vaccine is not available, again, that may be part of the move towards doing the alternative administration of the vaccine.
And do you get, obviously with COVID, it was different because it was a new vaccine, obviously ramping up the supply early months of the pandemic. Is this more so just pivoting? I guess this is more the federal and state government, but pivoting to make more of this vaccine? Or I guess, what have you heard from state partners in terms of getting more doses in that respect?
Yeah, my understanding that this is a federal supply process. And so the federal government is contracting with the producers of the vaccine. And, it's not limited to our country. A lot of countries are, again, trying to obtain this in much larger quantities than they've needed in the past.
The manufacturers don't typically make a ton of monkeypox virus vaccine because monkeypox hasn't spread in this way before. So I do know that the federal government in July made an order of 2.5 million additional doses. And obviously it just takes the manufacturer time to ramp up their production capability to produce those, given that you need specialized laboratories and facilities to produce it.
It's helpful. Thank you, everyone.
All righty, thank you, Steve. I do not see any more requests for questions from members of the media on the chat.
I have one.
Who is this? Oh, can you identify yourself, Kalan?
Yeah.
Wamu? Go ahead.
Hi, sorry about that. Just switching gears real quick. This is Callan Tansel-Sudeth from WAMU and DCist. I'm wondering, County Executive Elridge, if you have what is your response to David Blair's request for a recount?
He has a right to request a recount. So he did what he's perfectly entitled to do.
Okay,
So-
and
Fine with me.
have you been given any insight from the Board of Elections into a timeline for how long it will take?
But nothing's precise. The sense we got was that they would start counting on Friday, they would count on Saturday. Whether they count on Sunday is not known necessarily. But if they don't count Sunday, they definitely count Monday. It should be finished early in the week, but I don't think anybody's certain about how fast they'll be able to go through them. So I'm pretty certain that by Wednesday we'll have a result. I heard an earlier day, but I'd rather just say I hope by Wednesday.
Great, thank you very much.
And I just want to add one thing. When I was talking earlier, I made a mistake I've made a couple of times. I was referring to the Board of Elections and I said Board of Education. The State Board of Elections has petitioned the court to allow the early counting of the ballots in the general election, not the State Board of Education, which would no doubt be ignored by the court were they to file the same thing. So I just wanted to be clear about that.
Thank you, Mr. County Executive. Thank you, Kalan, for your question. Reporters, any more questions for the county executive or the other officials? No? Okay, going once, going twice. I guess we're done for today. Thank you, everybody, for joining us. Stay safe. We'll see you next time. Have a great afternoon.
Thank you.